A 60-year-old earning $62,000 pays about $515 a month for health insurance. The same person earning $64,000 pays $1,244 a month. Read that again. A $2,000 raise costs this person an extra $8,748 a year. That's not a typo. It's real math, happening to real people right now. It's called the subsidy cliff. And it came back this year, for the first time since 2021. Millions haven't thought about this in 5 years. Everyone assumes more income is always better. Usually it is. There's a specific income line where earning one more dollar can cost you thousands more than that dollar was worth. I'm Kevin. This is Prosperity Levels. Today, why the subsidy cliff returned, the real math, who's most at risk, and the legal ways to protect yourself. Quick note, not a financial advisor. This is educational. Let's talk to a professional, especially if these numbers apply to you. This is fast-moving current policy. Verify your own numbers. To understand why this matters now, you need the 5-year backstory, because most people missed it entirely. In 2021, the American Rescue Plan temporarily removed the hard income cap on ACA subsidies. For that, crossing 400% of poverty meant zero help, no matter the cost. Extended again through 2025. During those years, nobody near that line had to think twice about a raise or bonus. The subsidy simply phased out gradually. No cliff, no sudden jump. That protection expired December 31st, 2025. As of January 1st this year, the original rule is back. Cross 400% of poverty, and the credit doesn't shrink, it disappears completely. For 2026, that line is about $62,600 for a single person, $84,600 for 2 people, $128,600 for a family of 4. Alaska and Hawaii have higher thresholds. Nearly 750,000 people sit in the income band just above this line. And sign-ups from that group dropped 44% this year, the largest decline of any income group. Let's slow down and walk through why a $2,000 income difference creates an ardent $8,748 premium difference. Under the ACA's original rules, if your income is at or below 400% of poverty, the government caps your benchmark plan payment at a percentage of income sliding scale. Government covers the rest. $62,000, our example is just under $62,600. Their capped contribution, about $515 a month, roughly 10% of income. At $64,000, they've crossed the line. No partial credit. The tax credit drops to zero. Full unsubsidized price. About $1,244 a month, roughly 23% of income. The math. $729 more per month, times 12, equals $8,748 more per year for earning $2,000 more. Net effect, $6,748 worse off for the year. Scale it to a family of 4 at $128,600, a single freelance project or bonus. Pushing them $500 over the line applies the same all-or-nothing mechanism. Most people receive this credit in advance monthly. If your income ends up higher than expected, you may have to repay some or all of it. A surprise bill the following tax season. Average premiums also rose 18 to 26% this year, and average deductibles climbed to $3,786, up 37%. Someone off the cliff absorbs both increases with zero help. This doesn't affect everyone equally. A few groups sit disproportionately close to this line. First, people in their late 50s and early 60s, not yet on Medicare. Premiums rise sharply with age. A 60-year-old's plan can cost 3 times a 25-year-old's identical plan. Second, self-employed people and freelancers with variable income. They may not know until December whether they've crossed the line for the year. Third, households near retirement drawing down savings. A larger withdrawal or capital gain counts toward this income to a single financial decision can push you over. Fourth, dual-income households where one partner gets a raise or second job. Total household income is what counts, even if neither person individually earns close to 6 figures. If you buy insurance through the ACA marketplace and your income sits within roughly 15% of these thresholds, this cliff is worth checking before year-end. The ACA subsidy cliff is the most dramatic current example, but not the only place a raise can technically make you worse off. Several other income-based programs work on similar thresholds, certain Medicaid cutoffs, CHIP thresholds. State assistance programs mechanics vary by state. Any benefit based on a hard income line rather than gradual reduction creates the possibility that earning slightly more leaves you with meaningfully less. This is why advisors talk about the last dollar. It's mattering more than the average dollar. It's not your total income. It's whether your final dollar crosses one specific line. Here's the useful part. For many households, this cliff is legally avoidable because it's based on a number you have real control over, MAGI. Strategy 1. Maximize pre-tax retirement contributions. Every dollar to a traditional 401k or IRA reduces MAGI dollar for dollar, pulling you back from the edge. Strategy 2. Use an HSA if eligible. HSA contributions also reduce MAG directly, doing double-duty tax-free savings and subsidy protection. Strategy 3. Time your income deliberately if you have control. Self-employed people can shift invoicing or defer a bonus into the following year, planned well before December. Strategy 4. If you can't reduce MAGI enough, compare a bronze plan against the benchmark. Silver plans stepping down in coverage tier can substantially reduce the full, unsubsidized cost. Strategy 5. If your income is unpredictable, check your estimated MAGI partway through the year. Catching an overage in June gives 6 months to adjust, instead of discovering it too late. This isn't a claim that raises are bad, or that you should turn down income without running your own numbers first. A few honest caveats. This cliff only applies to people who buy insurance through the ACA marketplace without employer coverage. If you get insurance through your job, this doesn't apply directly. This is current law as of this video, not necessarily permanent. Congress has debated extending enhanced subsidies, including a House-passed bill that hadn't cleared the Senate. The exact dollar impact varies by age, location, and plan. The $8,748 example is real for a 60-year-old. A 30-year-old at the same income would see a smaller impact. Most financial advice assumes more income is unambiguously better for most of your income. That's true. But right at specific thresholds, the marginal dollar can be worth less than nothing. The subsidy cliff isn't a reason to avoid raises. It's a reason to know exactly where your income sits relative to these lines while you still have time to use 401k, IRA, or HSA. If this is the first time you've heard the subsidy cliff came back this year, hit the like button. Final numbers. The cliff sits at $62,600, $84,600, $128,600. Crossing it can mean losing thousands. In our example, $8,748 a year lost from a $2,000 raise. Subscribe for more. Next video. The legal loophole high earners use to max out a Roth IRA anyway, even when the IRS says their income is too high. This is Kevin. This is Prosperity Levels.